So today in Edmonton, we are hosting a transition to practice event. We're partnering with the Professional Association for Resident Physicians of Alberta, and for the fourth year, we're bringing together resident physicians that are currently training in Alberta with healthcare partners. It's transition to practice. A lot of these residents are used to working on site in our urban areas, but not necessarily in our rural areas. So lots of the information that we particularly hand out at our booth is regarding rural practice. So just some of the supports that we provide to physicians that are going into rural practice, contact information for partners, extra training opportunities, just things like that. And they might also rely on us to help them make connections in communities that they're already interested in. So we provide that, where we can be sort of a matching service between areas of the province that are hiring and recruiting and resident physicians that are ready to move into full-time practice. So we can introduce them to the right people.
My name is Chris Bevington. I'm a family medicine resident at the University of Alberta, and I'm in my first year right now. Part of events like this is me figuring out what's best for my future and what opportunities are out there and what to pursue. So I'm interested in an enhanced skills residency program. So after my second year of family medicine, I'll likely pursue a third year in an enhanced skills program likely related to anesthesia or possibly sports medicine. Each of those opportunities, each of those programs, there's a place for me. There's somewhere that I could work with that. There's demand for physicians with enhanced skills in women's health, in anesthesia, and it can be closer to home than you think. All over the province there's definitely these opportunities, but some places that you'd never think of, Jasper for weekend locums, is definitely a possibility. And lots of opportunities in the rural areas. The south of the province, the north, the central zone, outside of Edmonton and Calgary, there's tons of opportunities out there. So
one thing that's important about tonight's events is it's just a continuation on from the ways that RPAP, Health Workforce for Alberta, supports physicians through their medical education while they're in med school, through their experience as a physician resident, through their transition to practice into full practice. So RPAP is an organization in Alberta that works side by side supporting physicians right from undergraduate through their med school, through their residency process until they become full practicing physicians in Alberta. So that is one of the things that, and probably the most important way that we influence healthcare in this province.